We're using a PDF file because the file is so large. So just imagine that the animation is all synced perfectly. Welcome to Shared Decision Making for Aging Veterans. This is Shared Decision Making Facilitation Training 2, the third component of a three-part orientation and training series for the implementation of shared decision making for aging veterans at a clinic, in a service line, or a program such as home-based primary care. This facilitation training should follow a leadership orientation for your facility and program leadership, and shared decision-making Team Training 1 for all members of the clinic or team. This training will briefly review Team Training 1, but we assume you have already completed that training. Facilitation Training 2, like Team Training 1, is designed for VA staff. However, if you work in a non-VA setting, you may find this training is also valuable in your organizational setting. We will start with a review of shared decision-making for aging veterans and its implementation guidelines. Then we will cover involving veterans, family caregivers, and the entire care team in the shared decision-making process. We will discuss having collaborative shared decision-making discussions, including openers, the importance of goal identification and assisting the veteran in identifying what matters most to them, and general strategies and techniques for effective discussions. We will explore common challenges and issues encountered in the shared decision-making process and strategies for overcoming them, and we'll review how to address potential barriers to implementation. Then you'll practice shared decision-making facilitation skills using case studies. Last, we'll review what's involved with taking the next steps for implementing shared decision-making for aging veterans. There is one video clip embedded in this training. To activate the video clip, click on the arrow. There are many valuable references and additional resources for much of the information provided in this training. They can be accessed by clicking on the magnifying glass icon in the lower right corner of many images on the slides. At the end of the training, there is a quality improvement assessment and an opportunity to provide feedback. Thank you for taking time to complete this assessment, as it will help us improve future trainings. Let's get started by reviewing shared decision-making and the implementation guidelines. Shared decision-making is a collaborative, patient-directed decision-making process for preference-sensitive choices. Remember that preferences play a large role in the choices that are made, like choices of what to order from a restaurant menu. In our work, we are talking about topics where choices are also preference-sensitive, both choices among long-term services and supports, and choices one makes in developing advanced care plans. The shared decision-making process can assist veterans in clarifying their goals based on discussions of what matters most to them. It can help them assess their needs, including their health-related needs, and establish priorities and make choices that align with their goals and priorities. An important shared decision-making outcome is making decisions that are in alignment with what matters most to the veteran. Input from the healthcare team ensures the veteran understands the likely course of their illness or conditions and how those affect their needs. This information may affect the choices they make. It also involves multiple members of the care team, as well as the family caregiver or caregivers, if the veteran has them and is willing to have them involved in the shared decision-making process. Of note, shared decision-making is an evidence-based approach. It has been shown to increase patient knowledge, improve patient satisfaction, and reduce decisional conflict. And decision aids have been shown to assist the process of shared decision-making. We focus on older veterans because almost half of the veterans served by Veterans Health Administration are over 65. And about 70% of all people over 65 will need long-term services and support someday. Those over 80 are the fastest growing cohort of veterans, which means that they will be facing lots of choices for which shared decision-making is a valuable tool. And as you may recall from Team Training 1, a primary goal of the shared decision-making process is to shift the locus of decision-making from a medical model focusing on provider expertise toward a process of patient-directed decisions. As we move across the spectrum from the more traditional medical model toward patient-directed care, we move through a place of patient-centered care. Patient-centered care focuses on issues such as ensuring that people in community living centers can eat and sleep on their own schedule. Patient-centered care is important, but it does not address how decisions are made. Patient engagement begins to address involving patients in the decision-making process, but this may still fall short of having them be the central decision maker. With patient-directed care, not only is the patient involved, but ultimately the decisions are theirs. Guidelines for implementing shared decision-making for aging veterans include: provide and review the hard copy materials contained in the shared decision-making folder. The entire care team can help with this. Encourage use of the Geriatrics and Extended Care website, www.va.gov/geriatrics. We know from research that many veterans give credence to what their providers say, so physicians, physician assistants, nurse practitioners, nurses, and other care team members should recommend use of the website. It is very helpful to go online while the veteran is at an appointment so that the veteran and family see the website and recognize its value. Connect veterans with a social worker or the primary person facilitating the shared decision-making process. Again, this is an area where nurses, physicians, and other care team members can be involved by making referrals or helping veterans and family caregivers. Encourage the veteran to involve a family caregiver if there is one who can reasonably contribute to the process. And inform the veteran about the full range of long-term services and supports. Remember that it is important for the veteran and family to be aware of all long-term services and supports, not just the ones you think suit them best. Do not limit information to the services provided by VA or the services available in the immediate community. Veterans and their families need to be well informed about the comprehensive range of services so they can make the choice that is best for them, including moving. Encourage use of the decision aid worksheets to discuss the veteran's goals, needs, and preferences. Team members can help by encouraging veterans and caregivers to complete or at least carefully review the questions on the worksheets. Then the worksheets can be used in discussions whether or not they are filled out. The use of the information and questions on the worksheets can facilitate collaborative conversations as veterans and families are more prepared to discuss their goals, needs, and preferences. Prompt the veteran to talk with their medical care provider to obtain information about the likely course of their conditions and get their questions answered. Veterans and their families need to understand the influence their health conditions may have on functional status. This will put veterans in a better position to make choices that align with their goals. Foster collaborative discussions that include involvement of the veteran, family caregiver, social worker, and care team. And facilitate decisions and referrals, whether they be about long-term services and supports or other care decisions that support the veteran's goals. Let's review strategies for involving veterans, family caregivers, and the entire care team in shared decision-making discussions. Shared decision-making for aging veterans can be used for making choices, any choices, but particularly those preference-sensitive decisions about topics that frequently address the needs of our aging population. Applying the shared decision-making process takes a team effort with the veteran at the center. In many cases, these decisions are supported by collaboration by one or more family caregivers and with involvement of multiple care team members, including a physician, nurses, and a social worker. There are a number of ways one can encourage the veteran's involvement as key decision maker. Keep in mind that some veterans will say they do not want to be involved, but we know from research that most like being involved once they begin the process. To encourage involvement in the shared decision-making process, one can help veterans to identify their goals, needs, and priorities, prompt them to ask their providers about their health conditions, review information about long-term services and supports and advanced care plans, and encourage use of the veteran shared decision-making worksheet, and urge veterans to discuss their choices with their care team and their family caregiver. The family caregiver or caregivers may or may not live with the veteran, and the relationship may be more or less positive. In most cases, involving the caregiver should be encouraged, as independence as we age is often dependent on family caregiver support. A helpful caregiver should support the veteran as the key decision maker, encouraging them to express their own needs, but not to taking over the decision-making process unless the veteran requires that type of support. Assist the veteran in assessing and expressing their goals, needs, and priorities with a focus on what is most important to them. Give input on their own needs and resources that may affect the veteran's choices about long-term services and supports. For example, if the caregiver cannot provide the expected amount of support, this may affect the veteran's choices. And participate in discussions about the veteran's advanced care plan, which details the veteran's wishes in the event they cannot speak for themselves. Often, caregivers are named as the healthcare agent and have a key role in the implementation of advanced care plans. It is also critical to involve all appropriate care team members within VA and outside of VA. That's one of the reasons part of the orientation and training for shared decision-making includes Team Training 1 for entire care teams, physicians and other prescribing providers, nurses, a host of other care team members, and social workers, who usually fill the primary role of facilitating collaborative shared decision-making discussions. Shared decision-making is a team effort with many team members participating in these discussions. To make sure messaging is clear to the veteran and their family, it is helpful to designate a primary contact person for the veteran and family caregiver, to clarify roles of various team members for a given patient, and to present consistent information about healthcare status and prognosis. As we have discussed, even with team participation, good information, and good training, shared decision-making discussions with older veterans can be challenging. Now let's review discussion strategies as well as how to facilitate the identification of veteran-directed goals, in other words, identification of what is most important to the veteran. Many people do not like planning for the issues that commonly arise as we age. However, an awareness and preliminary discussions about these topics can make decisions easier when they are needed. Here are some strategies for encouraging veterans and caregivers to engage in collaborative shared decision-making discussions. When you describe the benefits of shared decision-making, try openers like, planning ahead gives you time to learn about long-term services and supports and allows you to make important choices when you can focus on them without pressure. Or, others have said they have peace of mind when they know what they'll do if they can no longer make decisions for themselves or experience declining health. Or, taking time to think about your goals and discussing them with your family, healthcare providers, and me will help you be mission ready when and if you need long-term services and supports. The same holds true for making advanced care plans. This will help you be mission ready when and if you are not able to speak for yourself. To support collaborative, patient-directed plans or decisions, start with a discussion of the veteran's goals. What is most important to them? Use the veteran's shared decision-making worksheet, either filled out by the veteran or used as a discussion starter. Veterans' values inform their goals. Shared decision-making discussions can help veterans translate their values into goals so that those goals reflect what matters most to the veteran. Many healthcare team members and patients find that it is challenging to discuss goals. Try focusing on two main questions. What's working well in your current healthcare and the way you manage your conditions? And what bothers you or is burdensome or what's not working about your healthcare? Also, when you are facilitating discussions about goals, ensure that choices and plans align with the veteran's values and are directed at achieving their goals. Encourage veterans to speak up if their current or proposed treatment or care prevents them from reaching their goals, and to ask how it can be revised to help them achieve their goals. Discuss how achieving goals is related to the amount of effort the veteran is willing or able to give. As always, support and respect the veteran's choices. And you'll want to encourage periodic discussions going forward because both health status and goals can change over time. Shared decision-making discussions can be sensitive, so they rely on trust among the participants. It takes practice to become skilled in having conversations about goals and preferences. In addition to good communication skills, such as starting where the veteran is at and using open-ended questions, prepare yourself by making sure the environment is set up well, quiet, and free of distractions. Allow enough time to accommodate the various aspects of aging that may impact optimal communication. It also takes time to elicit veterans' values, goals, and preferences. When talking with veterans and family caregivers, ask them if they are ready to talk about sensitive topics. Talk in a straightforward way, avoiding jargon, and keep in mind that about 60% of Americans over 65 have low health literacy. Focus on what the veteran says or asks, not on your reply or a solution or fix. Demonstrate empathy when appropriate, with statements such as, "That sounds difficult." Focus on strategies for maintaining independence. Try openers like, "Let's talk about living with Parkinson's," or whatever the veteran's conditions are. Then check to ensure that what you said was understood and clarify any questions and concerns. And try integrating other skills you have or for which you may have received training with shared decision making, such as Teach for Success, also known as Teach Back, or motivational interviewing. If these are not techniques for which you have received training, there are many excellent online courses available through the talent management system. A brief introduction to Teach Back is provided on the next slide. Teach Back is a communication confirmation method used to confirm whether a patient or caregiver understands what is being explained to them. If a patient understands, they can teach back the information accurately. To make sure what you've explained has been understood, you might say, "Help me know if I've done a good job explaining the options. Tell me what you understand about home-based primary care." Or fill in that last part with whatever you have just explained. Or, if you needed to explain adult day health care to your husband, what would you tell him? Again, you can learn more about this technique through online courses available from Talent Management System. Excellent listening skills are essential for effective collaborative shared decision-making discussions. If you are a social worker, this is probably one of your basic tools. Here's a refresher on the basic tenets of active listening. Face the speaker and maintain eye contact, if culturally appropriate. Be attentive but relaxed. Keep an open mind. Listen to the words and try to picture what the speaker is saying. In addition, don't interrupt or impose your solutions. Many active listening skills are well suited to shared decision-making, including paraphrasing, summarizing, questioning, and clarifying. To learn more, take an online course through Talent Management System or a workshop on listening skills. Now we'll switch gears and focus on overcoming a range of challenges you may face when using the shared decision-making process, along with some suggested strategies for dealing with them. Keep in mind that issues related to aging, like dementia, can complicate the challenges we'll discuss next. These challenges include discomfort with discussing topics related to old age, sickness, and death, complexity of long-term services and supports options, long-established family dynamics, strong emotions and/or mental health issues, and cultural and religious preferences. Shared decision-making conversations about long-term services and supports or advanced care plans are de facto connected to old age, sickness, and death. These are topics that few older people want to think about, much less discuss. As a result, barriers to shared decision-making conversation arise, such as denial, fear, and avoidance related to discussing the aging process, chronic diseases, and getting worse, loss of independence, and death. And reluctance to participate in discussions among those who are more comfortable with the doctor making decisions for them. It may be hard to strike a balance between respecting autonomy and stimulating involvement in shared decision-making. Open-ended questions may be a more effective way to elicit what matters most to the veteran, such as, "Tell me about your priorities." Or try a universal, non-threatening approach by sharing a story or saying something like, many veterans your age are completing, or many veterans who have the same condition are completing an advanced directive or starting to think about their plans for aging right where they live now. There are many options for long-term services and supports, and that's good. The ways services are provided and the eligibility requirements for the services, however, are often complicated. Many veterans need help understanding the full range of services and where those services may be available before they can decide which options will come closest to meeting their needs and aligning with their preferences for where they live or other lifestyle or personal goals. If possible, use the website www.va.gov/geriatrics to show the comprehensive range of long-term services and supports. This can be supplemented by the hard copy Overview of Long-Term Services and Supports, which has less information but may be more accessible to the veteran and their family. Keep in mind that for some veterans, particularly those in rural areas who do not have internet access or who do not use computers, looking at the website and the resources contained there during a visit with their social worker is likely to increase their understanding about potential long-term services and supports options. The website offers more detailed information than the handout in the folder, and most topics have a 2 to 4 minute video as well as a Print This Topic button, which allows you to print handouts about specific long-term services and supports. And use the decision aid worksheets to facilitate a discussion of how long-term services and supports can help the veteran meet goals and needs. And even if a veteran does not want to fill out the worksheet, you can still go over the questions and issues. Family dynamics can pose many challenges. Past miscommunication and the resulting resentments can affect communication in the present. With communication among spouses or other family members, note that often people, including veterans, their loved ones, and those of us who work with them, assume that family members and friends can convey what we are thinking, feeling, and what we really mean to say. This is not a good assumption. It is not uncommon for us to feel surprised or annoyed when those close to us misunderstand what we're talking about. And talking with people we know well is often more difficult than talking with those we hardly know at all. One strategy for overcoming these issues is to try an opener that acknowledges these dynamics, such as, it's hard to talk about these topics and can be even harder when it's about us or involves a loved one. Strong emotions such as fear or anger may arise when facing chronic pain, lack of independence, or life-threatening situations. Many older veterans are also dealing with depression and/or anxiety or other mental health concerns. These can all be barriers to shared decision-making discussions and decision-making. It may help to observe, probe for, and acknowledge feelings. Refer to appropriate professionals such as mental health staff or the chaplain to address strong emotions or fears, if this is not in your scope of practice. And you might try an anecdote about others who have been through similar challenges and have used shared decision-making. There will be situations where cultural practices and preferences or religious issues influence discussion about long-term services and supports and choices. For example, many denominations have issued formal statements about end-of-life planning and care. Catholic leaders advocate life-sustaining treatment that does not lead to undue suffering, whereas evangelical leaders approve of withdrawal of life support that unnaturally extends life. Be sure to discuss the veteran's cultural or religious beliefs and their potential influence on long-term services and supports choices and advanced care planning decisions. Call on the palliative care team, chaplain, or social worker as appropriate. And remember that family caregivers may or may not be aligned in their beliefs and practices, and that this may be a source of challenges with family dynamics. Some veterans and their caregivers may take comfort in knowing what their denomination says about end-of-life treatment choices. And I note on slide 27, we need to cut out some text on the check boxes. In this section, we'll talk about shared decision-making and dealing with potential barriers to implementation, issues such as staffing, lack of support, and integrating new processes and resources. Focus on the implementation challenges you can control or will be most likely to influence, such as encouraging all team members to complete training, use the Geriatrics and Extended Care website, and share decision-making materials, electronic wait lists, and sharing success stories at staff meetings. In this section, we focus on how to deal with lack of services, lack of time, and dealing with changes like integrating the shared decision-making process and materials into your practice. And we will shorten that slide as well. We want to ensure that all long-term services and supports are available to our veterans whenever possible, but availability problems are not a reason to avoid telling a veteran about a given service. You may be concerned that informing veterans about services not available in their location could cause frustration and anger, but that is not a good reason to avoid informing veterans about services either. It's okay to acknowledge that not all services are available in all locations, but we want veterans to know about all possible options. This allows decisions to be truly veteran-directed. For example, if veterans and their families are aware of what is available in which locations, they may choose to relocate. We are often surprised by the choices veterans make when they have complete information. Of course, you'll want to explore services and supports that are available through VA and from the community. Veteran Community Partnerships is a national initiative developed by Veterans Health Administration's Geriatrics and Extended Care Services to ensure that all veterans and their caregivers have access to and choices among the services that allow our veterans to stay in the places they call home. And be sure to use electronic waitlists to document unmet need for long-term services and supports. By being diligent about using these lists, you are doing your part to assist decision makers to plan for and allocate resources. Click on the arrow icon to watch a 22-second video clip about the importance of electronic waitlists. Not having enough time for patient-provider or patient healthcare team discussions is often perceived as a barrier to shared decision-making discussions. Many social workers have told us that the initial investment of time into the shared decision-making process, including use of the decision aid worksheets, has helped save time in the long run. In addition, it may help save time by encouraging veterans to be prepared for visits or calls by writing down their questions, looking at the Geriatrics and Extended Care website, www.va.gov/geriatrics, prior to their visit, and or filling out the decision aid worksheet ahead of time. Or try a strategy used by other sites that have successfully implemented shared decision-making by mailing the folders prior to visits, providing information and materials at intake, inviting veterans to make future appointments with social work staff in person or over the phone, or by offering shared decision-making sessions in group visits or shared medical appointments. We acknowledge that it is often difficult for professionals to be convinced to change how they do things, and we know that many of you already use many of the principles of shared decision-making. We ask, however, that you consider adding some of the principles of this training and the materials we have developed to what you already do. The shared decision-making process and resources have been developed with extensive input from veterans, caregivers, and professionals like you. Veterans and caregivers benefit from your using this process. In quality improvement interviews, over 90% of veterans and caregivers said they benefited from shared decision-making and they would recommend it to others. So to get you started thinking about how you could integrate shared decision-making in your practice, please consider how could you use or encourage use of the GEC website and other shared decision-making resources to assist veterans and caregivers with understanding the full range of long-term services and supports. Check all the answers that apply. This last section presents workflow integration issues and taking the next steps to prepare for facilitating collaborative discussions with the aging veterans you serve. Now we'll practice facilitating shared decision-making discussions using case studies. Remember to combine what you already know and do in your discussions with veterans and their families with both what you have learned about the shared decision-making process for older veterans and the new tools presented, including the Veteran and Caregiver Decision Aid worksheets and the Geriatrics and Extended Care website. Hopefully, the case studies provided an opportunity to use what you already know and start to thinking about how you can integrate the shared decision-making process and materials in your work with older veterans. Situations will vary with each veteran's unique needs. In all cases, involve appropriate care team members and the family caregiver if there is one and the veteran wants the caregiver to be involved. Use the decision aid worksheets and help veterans identify goals and priorities, and use information from the decision aid worksheets in collaborative discussions with the veteran, family caregiver, care team, and social worker. Keep in mind that these discussions may be asynchronous and may involve both long-term services and supports and advanced care planning. Use the Geriatrics and Extended Care website and shared decision-making folder to inform veterans and family caregivers about all potentially appropriate long-term services and supports. Ensure veterans understand their medical conditions and how they may affect function and health status over time, and support and respect veteran-directed choices. This last section presents workflow integration issues and taking the next steps to prepare for facilitating collaborative discussions with the aging veterans you serve. Tips are offered to assist leadership in integrating shared decision-making into your clinic or service line and to encourage staff involvement on an ongoing basis. To optimize workflow integration, be sure to remind team members who have not completed Team Training 1, as well as any new hires or students who join your team, to complete this training online via Talent Management System or TMS. And ensure all social workers and any other team members who will be facilitating shared decision-making discussions have completed Facilitation Training 2. For planning, decide who will do tasks such as screening and ordering materials. Select screening criteria and communicate it to staff. And in terms of logistical issues, you'll want to know your start date soon after this training is completed, obtained the shared decision-making folders, wallet cards, and brochures. And for materials or implementation resources, please contact us via email at sdmagingveterans@va.gov. Social workers across the country are taking the lead with implementation of shared decision-making, getting the process and materials integrated into current workflow and practice. Here are some examples of ways to encourage and maintain team involvement. Urge clinic leadership to select screening criteria. Which screening criteria are selected can vary by clinic. Provide examples used by other clinics across the country to screen for involvement in shared decision-making, by age, or any veteran who would benefit from long-term services and supports, and shared decision-making process, by assessment score, by lack of an advance directive or one or more factors such as multiple chronic conditions, weight loss, multiple missed appointments, or chronic progressive disease, and lives alone. Once criteria are selected, offer to help educate staff, and then remind team members to make referrals to the social work staff. Many social workers have shared ways that they encourage staff involvement with the implementation and integration of shared decision-making. They share success stories and thank team members for referrals. They present brief case reports at staff meetings, highlighting a different aspect of the shared decision-making process, or a specific home and community-based service, or an effective strategy for supporting veteran-directed choices. Develop a plan to bring new staff or team members up to speed by suggesting they complete online Team Training 1 and acquainting them with the materials and about how shared decision-making is done at their site. And they use national campaigns like Caregiver Month in November, national recognition days like Healthcare Decision Day in April, or site-specific events like a long-term care fair to highlight shared decision-making for aging veterans and keep staff awareness levels high. Be sure to visit www.va.gov/geriatrics often and explore the information, resources, tools, and links about all aspects of shared decision-making for aging veterans. If you're familiar with the website content, you'll be in a great position to recommend that the veterans and family caregivers you work with take time for a visit when they are at home and use it during collaborative shared decision-making discussions in the clinic, over the phone, or via telehealth. Thank you for completing Shared Decision-Making for Aging Veterans Facilitation Training 2. Whether you work at VA or not, if you have questions about or interest in shared decision-making implementation or want to order materials, please email us at sdmagingveterans@va.gov. We look forward to hearing from you.